Hey, this is Dr. Cruz, and today we have a persistent gouty attack. So the patient was recently diagnosed with gout. Well, we kind of knew there was a history of gout, but we never were actually treating it. So we sent the patient for a blood test, and the uric acid level came back really high. And so then he coordinated with his primary care physician to get him on anti-gout meds. And so he's been on it for 15 days. So far, but if you read the fine print on these medications, they say they can cause a gouty flare, even though it's counterintuitive, right? We're taking it to prevent gouty flares, but nonetheless it still happens. So he is here again with a gouty flare-up, and I am going to alleviate his pain by draining the gout. Okay, so we basically anesthetize him. We numbed up this area here, and I'm going to use a bigger gauge, 18 gauge needle to be able to aspirate out the gout. Okay. So as long as he's not having any pain, we're going to continue. So you feel anything sharp right here?
No.
Good. Anything sharp?
No.
Good. Okay. And I remember the first time I did this. I think we did this once before, right?
Mm-hmm. We sent to the big goat,
and I thought it looked like his joint looked like a classic gout, okay? But then the differential diagnosis was septic joint because it looked like pus, but it was actually just gout. So that's good. Well, sort of good. But you and I both know that septic joints are not very fun to have either. So I may just have to squeeze this out because it's not coming willingly. Not very willingly. So we got a little bit in there, as you can tell. But I'm just gonna have to squeeze out the rest. Mm-hmm. Okay. I think that happened last time too, right?
Yeah, that's what happened last time.
Yep. So again, we're just trying to limit the mess here. Am I hurting you?
No.
Okay. I apologize if I'm having you. Let me know, okay? We're friends now. You can just yell at me. You can just yell at me. I took that oath, right? Do no harm. There we go. Okay. Sometimes I make more than one hole, but I try to avoid it just because if I can make less punctures, that's better, right? Less nidus for infection. Although they're tiny holes. Nope. 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 Very little left. All right. So I think that's all she wrote.
Okay. Yeah,
looks pretty good.
yeah. Last time, I think a day or two later, it
Kind of puffed up again. Mm-hmm.
came out.
Oh yeah, it leaked out a little bit.
Then
Right.
I put a little pressure and some more came out.
Yeah. I'm gonna try to. Is it hurting you? I mean, I'm pushing a lot of pressure, so I'm assuming I'm hurting you.
It's not.
It's not comfortable.
It's not comfortable. It's not. I think it's just
Okay.
pressure on the bone.
Yeah, I know. So I'm just gonna make one more hole, okay? Just for fun. Right here. Any pain?
No.
No, nothing sharp?
No.
Nothing sharp?
No.
Good. Okay. Nothing. Oh, okay. I think we are all done for now. If something oozes out, you know what to do.
Right.
But keep taking your anti-gout meds, your allopurinol, right? Is that what you're on additionally?
Mm-hmm.
You're not in any excruciating pain, so I don't need to prescribe you any colchicine or anything like that. Okay, cool. So we don't have to do that. So what you saw was gouty aspiration. The first MPJ, it usually attacks the first big toe joint. That's typical red hot swollen joint. is typically gout and pain out of proportion. So today he's not so bad, maybe because he's on the meds, and that's obviously a good thing. So he doesn't have to suffer the gout pain. Usually people call it the gouch, right? Because it hurts so much. So patient's going to do well as long as the uric acid stays down. Then he won't have these collections of sediment of the crystals. So yeah, that's what you witnessed. Aspiration of gout from first big toe joint, right foot. Good stuff. All right, guys, subscribe to our YouTube channel. Subscribe to our @HealthyFeetPodiatry on Instagram and @JCPodiatry on Instagram as well. And I will see you again next time. Thanks.